He never wore support stockings, right? He should have. He was an anesthesiologist. He was on his feet, more than 40 hours a week. But I'm concerned that I may be going down that route.
Well, that's not going to happen on my beat. Okay, it's not going to happen on my beat. These are some pretty mature spider veins here. You even have a little bit of discoloration, or what we call hyperpigmentation. But we're drilling down to take care of just that. And so what we've been doing is we've been taking care of the medical part at this point. You've had reflux or venous insufficiency in both your saphenous veins, in both legs, your great saphenous veins, and both small saphenous veins. And we've closed both small saphenous veins and both great saphenous veins, and so we've turned off the leak in the attic.
Okay.
And what we're seeing down here is the flood in the basement.
I'm concerned about this one because it really itches.
Well, we're going to get rid of that.
Okay.
So what we've done is we turned off that leak in the attic, but you still have water in the basement, and that's what's going on here. These varicose veins that we see here are no longer under pressure, or under very little pressure, because we've turned off those leaks.
Yeah, I can feel the difference.
But in order, we'd like to hear that.
Yeah, I can.
But we're only maybe 70 to 80% of the way there. And so what we need at this point is to bail all that water out of the basement. And the way we do that is with ultrasound-guided foam sclerotherapy. So what we're going to do with the ultrasound machine is we'll get a better look at these, and through a very tiny needle we're going to inject this foam. And the foam works better than a liquid because a liquid, when you inject it in there, it gets diluted by the blood. But the elegance of foam is it pushes the blood out of the way and it acts undiluted on the vein wall, and then it kind of dissipates. And it's been used for decades, and it's very popular in Europe. It's more and more popular here. We take an FDA-approved substance. It's a colorless liquid called Sotradecol. It's basically a dilute detergent, and what Sotradecol is approved for is treatment of spider veins. Okay. When we mix it with air, however, it makes this foam, and it's much more powerful. And it's a very elegant way to get rid of varicose veins. And in my opinion, it's just as effective as laser. What's different about it? Once we mix it with air, it's no longer FDA approved. The federal government says, you've changed the consistency of it or the characteristics of it, so they don't consider it FDA approved. But let's put that in perspective. There are many, many drugs that are approved for one thing, and then we use them for 10 different things. Same with medical devices. There probably will be an FDA-approved foam in about a year or so, because there's been a company that's willing to go through that expensive approval process. But this is done by the thousands every day around the world, and it's pretty darn safe. But I'm gonna go into some of the nuances of it. But for right now, I'm going to just stick with the FDA-approved liquid, and then we'll move to the foam. So if we were to be treating your spider veins today, they'll disappear before your eyes for about a minute. So it's a lot of fun to watch. It's like an Etch-a-Sketch. Okay, so it's what I call a preview of coming attractions.
All
right. Not today. Not today, because we need to get rid of the deeper stuff. If we don't get rid of the roots, then these weeds here are not going to go away. So we still got to get rid of that, but we'll drill down there and
drill is a bad word.
But believe me, I won't use that then. But we'll get to those small spider veins at the end of the treatment, because we want to make you feel better, and you already do. But I also want you to look better, because you're going to be a walking advertisement, and I can't send you out feeling better without looking better, because I feel so much better. My vein, he did such a great job on my veins, and they're going to go, what are you talking about? So at that point, it's a matter of pride, and you are a walking advertisement, and that's what we do here. We treat one patient at a time, make sure you're happy and satisfied, and then you can show everybody. And if you want to tell them too, that's fine.
I do.
So anyway, so we're kind of midstream with your care. So I'm going to get back to the liquid, and then I'm going to get to the foam, just kind of the risk, benefits, and alternatives. So when we do spider vein sclerotherapy, we use a needle the size of a hair shaft. It is literally the size of a hair shaft, and no one's ever hit us, cussed, or left for anything that we do here. But we would take that colorless liquid, we'd inject it in these little spider veins, and they'll disappear for about a minute or two, and then they'll become pink and inflamed. So they're going to look worse before they look better for several weeks. But then they'll fade and go away. And to get rid of spider veins, it takes several sessions, and probably a minimum in you of 3 sessions, because it's a lot like creating a masterpiece. We want to do several coats of paint, and it'll look better incrementally with each session. You don't want to go in there and just bomb these things, or the results aren't very good. So anyway, that's the spider vein sclerotherapy. The risk to that, there are very rare allergies to it. I've never seen an allergy to it. What else? 10% of patients are going to get a little bit of pigmentation, or what that is a little blood will leak out of the veins and it will stain the skin a brown color. It's basically the iron in the blood, and it will take many months sometimes for the body to absorb that blood or that iron and make it go away. It will go away, but it will be a little reminder of the treatment for a little while. The worst thing that can happen with liquid sclerotherapy is ulcer formation. It's very rare. It's maybe 1 in 5 to 1 in 10,000 patients will get a dime-sized ulcer. That's very rare. I wouldn't worry about that, but it's just one of the unpredictable things that can happen with visual liquid sclerotherapy. Now, what's foam? When we mix it with that air, it's much more powerful, and we can get rid of veins this big or this big. It's really incredible stuff, and it's a very elegant way to get rid of these varicose veins. Some experts, some world experts, think it may replace everything that we do, and I do believe it's incredibly effective. What's elegant about it is when I inject it, I can actually see it on the ultrasound and push it into all the little nooks and crannies. And that's where we have a major advantage over surgery. When they do ambulatory phlebectomy or microphlebectomy, pretty much they have to take these out through small incisions, but they can only take out what they see. A surgeon will only take out what they see. But there's so much more going on underneath that we see in the ultrasound. And your veins cannot hide from my ultrasound. So when we put that foam in there, every abnormal vein, literally, we're going to get and eliminate. So foam's really good that way. What are the 2 extra risks with foam over the liquid sclerotherapy? 2 things. People that have migraines, it's been reported to possibly induce migraine headaches. That's quite uncommon, but it's a possibility. The other thing is there's been probably a dozen reports in the world literature of people having strange neurological reactions after foam sclerotherapy. Obviously an alarming thing. Nothing's been permanent or serious that I'm aware of, but it can happen. They think it's related to the volume of foam that's used, so there's a consensus about 5 years ago not to use more than 10 cc's. So we never use more than that amount when we treat the patients. Actually, as literature as current as 6 months ago, it's starting to show that some of these, what we think are neurologic symptoms, are really like a migraine aura, if you know what that is. Some people with migraines will get very serious neurologic symptoms, like numbness in the hands, spots in front of their eyes, and all sorts of things. And so we're starting to think it's not necessarily a transient ischemic attack or a mini stroke, but actually just something that resembles a severe migraine headache. In any case, any questions? I spewed a lot out at you.
No, not at this time.
All right.
One question for you.
Yes, sir.
I think you said there's 3 of these visits like this.
Yes. What you're referring to is after laser closure of these truncal or larger veins. Generally, I'm going to do between 1 and 3 sessions of foam to get rid of the veins.
Okay.
It's hard to predict.
Well, the reason is that I think she had said they like to have it fairly soon after the laser you've done.
How soon? One after the other?
She has planned a trip in early May, like the 2nd, to go out of the country.
Yeah, there's we can accelerate things a little bit then, but the neat thing about vein care is we're not going to lose anything if we are in the midst of foaming things up. Everything
Well,
kind
we
of
didn't
builds on
want you to
itself.
think that, you know, because she's gone, she's been planning this a year.
Yeah, no. I wouldn't worry about that. But when are you leaving exactly?
The question is, between one and the other, how much time you want to, for there to be between one treatment, one foam treatment and the next?
Couple of weeks.
A couple of weeks.
Couple of weeks.
Mhm.
And if we have more work to do and you need to go on your trip, it's not a big deal. We're
Yeah.
not going to lose anything. Everything's
be
kind of
going back on.
foundational or like a building
Right.
block, and so we can start over at the end of the summer and we wouldn't have lost anything.
Okay.
Well, because
May
she's gonna be
2nd.
gone a month, and her word was, you know, I want my trip, but this is
Yeah,
important.
no,
So,
I wouldn't cancel.
just to let you know what
No
her,
problem. I would not cancel your trip, and we'll do as much as we can safely before the trip, and we just come back and we'll continue doing
Continue.
the foam.
Yeah.
And there's no liabilities there from my perspective. So anyway, why don't you go ahead and lay back and we'll get started here.